Between the heat and the rain, we really got to take care of our pets. It is Thursday, which means our veterinarian, Dr. Joe, is here to answer some of your pet questions this morning. And who did you bring with you today?
I brought little Bean here. He's about a year and a half old, little boy dog, really calm. He's probably half Chihuahua, half little terrier or whatever. He is a good little guy.
Yeah.
A lot of these dogs are a lot more hyper. Someone said to me, "Oh, is that an old dog?" And I said, "Nope, he's a youngster." So
yeah,
and he's with the Pet Adoption League. You can call our clinic or the number will come up on there. But just a good little guy. This is about as big as he's going to get. I don't even think he's 10 pounds. I think he was like 7.5, 8 pounds or so.
And for a Chihuahua Terrier mix, very calm, as you mentioned. He's very friendly.
He's very friendly. Just the nicest. So yeah, he'll just lick you. He's like, oh, okay, you know. And this is a good one. So.
Well, we do have a few questions that we got from online. People want to know about their pets. Very common problems. Sarah asks, my dog's breath smells terrible.
Yeah.
What can I do about it?
So bad breath can actually be from a couple of sources, but generally, most people are talking about the mouth, and you want you and your veterinarian to look and see if you really need a dental or if you have some gingivitis. Sometimes there's an abscessed tooth. But the other one a lot of people forget about is, and this dog is a bad example, but dogs that have long beards and stuff, schnauzers and Portuguese water dogs and stuff, and it actually a lot of times you wash their hair around their mouth and it'll smell a lot better. I've done that in the exam room. People are like, oh, it went away, and I'd be like, yeah, it's kind of just they just use baby wipes and or keep it clipped.
So it could be an easy fix, home remedy.
Yeah, sometimes just the hair.
Without having to sedate them.
Because they slobber and dogs stick their face in the ground. I mean, they get dirty. So.
All right. Well, we do have some cat lovers out there, and Kevin wants to know, how do I know if my cat has a urinary tract infection, and how can I treat that?
Sure, absolutely. So urinary tract infections, frequently they're urinating a lot, going to their box a lot, they're vocalizing during it, certainly inappropriate urination around the house, okay? But you always want to start with a urinalysis to say, gosh, is this kind of behavioral? Because some cats can kind of mark sometimes, or is it really an infection? And then they kind of treat and go from there. So
could that also be kidney related, or?
Oh, absolutely.
Okay.
So yes, and there's a lot of things, a lot of clues. I'll tell people there's a lot of clues in a little urinalysis. You can tell whether they're diabetic and how their kidneys are doing. A lot of little things are clues anyway, not what they call pathognomonic, but definitely a lot of clues in it. So
just kind of pay attention to their behavior.
Absolutely.
Common problem here as dogs get older. Regina asks, my dog has fatty tumors that are not cancerous. Good news there, but should she have them removed?
Yeah, usually we don't remove them very quickly. Most of them we kind of watch, and honestly, if it bothers a dog, we've had some like under the armpit or something, and they can't walk very well. They can certainly be removed. A lot of people, it bugs them, so we'll remove them. The good time to do it is when you're getting a dental or something. Dental month's usually coming up in August. It's February, August, or whatever. Most of the time, I'll tell people it's not. You don't have to. No.
But basically, just depends on the comfort.
Correct.
Comfort level.
Correct. Yeah.
Well, Bean, as you mentioned, is available for adoption. A very sweet, about 1.5-year-old Chihuahua Terrier mix. They're very attentive.
Full set of ears there. He is.
Camera-friendly there.
He will put his ears way up here in a second, but he's a good one. Yeah.
Photogenic, good house dog if you are looking for a new family member. Dr. Joe, thank you so much.
Well, thank you so much
for being here.
Yeah.